ahead and get started. Thank you all very much for being here. This is an extremely exciting evening. For those of you who have been in this community for more years than I have, I think you can agree with me that this building does not look anything like it did even a few months ago. So I want to tell you that this is only the first phase of our Fulton project, and it is extremely exciting. We'll be having another event in 2012. We're going to go backwards. 2012, when the remaining services open. We're going to wait until we get through our Oswego County winters. So we thought we might kind of wait till spring before we show you the rest of the project. I do want to thank a few people, starting with the Department of Health. Without the HEAL funding, this project would never have happened. Most of you know that this is a $23 million project. The majority of that project is being funded with HEAL funds. So with a lot of people's efforts, we were able to receive Department of Health HEAL funding. Federal money passed through to the state. And I'd like to recognize Dr. David Britton, who is here. He is the Regional Director of the State Department of Health in our Syracuse office. Thank you, Dr. Britton, for joining us today. He's also brought Chris Chapelnucki, who is the Deputy Director, with him. So thank you. We appreciate the Department of Health sending some representatives today. Along with that, we knew that we could not finish the project with only $19 million. We needed $23 million. And we were able to secure another $4.5 million in legislative funds. So with Senator Ritchie and Assemblyman Barkley, we were able to continue to push forward with another $4.5 million in legislative funds. So we'll be hearing from both Assemblyman Barkley, and Holly will be speaking on behalf of Senator Ritchie. So we appreciate that funding as well. Without these grant funds, as I said, we would not be completing this project. We did not have to ask for any money from the community. So again, we are very pleased to be able to push this project forward. And we're pleased to announce that on Thursday, the Urgent Care Center will open at this location. Lab and medical imaging will be available to support our urgent care patients. And by the year's end, we anticipate that our outpatient lab, medical imaging, and the Occupational Health Service Department will be available through our new main entrance. You can see the steel framework for the entrance to the south. Physical therapy will be added soon after on the lower level, and this is going to allow us to relocate the services from the Rite Aid Plaza located a block from here. We anticipate additional services will be developed, including primary care on the lower level and potentially a physician joint venture on the main level. I really look forward to announcing the plans in the coming months. But I would be very remiss in not thanking other individuals. My corporate team, the board, the Oswego Health Board, who has stood behind us through every step of the way. Jeff Coakley, who has overseen this project. Jamie Cullinan, Chris Bloom, John Bucher, Dave Knoop, Dr. Kohler, and Lori Greeny, who are currently managing the Urgent Care Center down the hall and outdoors, all of the urgent care staff, Maureen Maselli, Marianne Cicerelli, and the community development staff who make sure that things go smoothly when we hold events like this, all of the construction crew, King & King, who helped design this project, and many others who we wouldn't be here today. So I thank you all very, very much for helping us to celebrate. Our medical staff, who make sure that we provide quality care every day, and to the Fulton community for believing in us and making sure that we continue to provide quality care. With this, I'm going to turn it over to Tom Snyder, our chair of Oswego Health.
Thank you. And on behalf of the Board of Directors of Oswego Health, I'd like to thank all of you for being here today and thank all of those who supported the project. I think we all know that the healthcare industry is very dynamically changing, and one of those dynamic changes occurred with the Berger Commission and the results that they came out with. I know that was a challenging time within this community. I think that we had made a commitment at Oswego Health that this facility was going to continue to provide quality healthcare services, and I think that today is an important stepping stone in that progress. And as Ann indicated, there are other additional services that we'll look to provide out of here. Along with the changing and evolving healthcare industry, we restructured the board of directors to be, over the last year, to really be more streamlined so that we can better position ourselves from a governance perspective to be more responsive to the changes that are occurring and to be work in better alignment with management. As part of that, I'm pleased that several residents of the Fulton and Phoenix area joined our governance. Bill Clark, who was a former chair of the Ailey Memorial Board, who's here with us today. Bill Vickery, who's a Phoenix business owner. Joe Cortini's chairing our Southern Oswego County Health Planning Committee and has really done a great job with that. Kim Rowley, who I see is here today, is also a member of that committee. So today, I think, is an important day in the evolving healthcare services provided within this county. Again, on behalf of the board, we're committed to supporting Oswego Health to provide exceptional health care to the residents of this region. And with that, I'm done. I'd like to turn it over. Holly, did you want to go first? Thank you very much.
Thank you. I'm here on behalf of Senator Ritchie, who was unable to make it today due to scheduling conflicts, but she asked that I thank everybody for all your hard work, and Fulton sorely needs this, so we are just so glad that you're finally opening the doors to such a wonderful facility. Thank you.
Thanks. I'm Will Barkley. I represent this area in the State Assembly, and let me say it's a pleasure for me to be here. And I probably shouldn't say this in front of a lot of medical professionals, but for me to say it's a pleasure to be in an urgent care unit. It's very rare. I don't like going to hospitals. I don't like seeing doctors or any of that. But coming here and seeing this beautiful facility, really, I want to say congratulations. It's been a long journey after the Berger Commission. Certainly we had a lot of fights trying to save the Fulton Hospital, but the one thing I felt confident, if we weren't going to be successful there, that we knew we had Oswego Health that could come in and fill the needs that we have in Fulton and in the Oswego County community. So I want to say congratulations to all of them, to Ann and Tom and all the staff at Oswego Health for putting this together. It's a beautiful facility, and look forward to the next ribbon cutting. So thank you.
I forgot Hainer Hoyt. I don't know how I could do that. They've been here with hard hats, and Jeremy Thurston, who is the president of Hainer Hoyt, is hiding behind John Bucher because John, no, it's not you, John. Thank you to Hainer Hoyt as well. It's been remarkable working with them, and I thank you. I also want to acknowledge that the mayor was going to be here, but he's sick. Hopefully he doesn't need urgent care and just feeling a little under the weather. So with that, again, I want to thank all of you for being here. We are going to do an official ribbon cutting, and we are extremely pleased and very proud to be able to have this as the first part of the opening of the Fulton Medical Center, and I always refer to it as the shining star, and it is going to be when it is complete. So thank you very, very much for joining us.